Hello, my name is Colton. I'm a physical therapist assistant student, and I'm going to be showing you some electrotherapy. Today we have a 23-year-old patient who has a lateral disc herniation, and she's having low back pain that radiates down to her leg. So we're going to treat this, and we're going to put 4 electrodes on her low back right here. And first, before we start, I'm going to ask her if that's okay with her to make sure that it's okay to expose those parts. So ma'am, is it okay if we expose these parts of your low back so we can place some electrodes there?
Yes.
All right. So let's go ahead and do that. And we're gonna just slightly pull down to her waist. And I'm gonna place these electrodes on her low back. Since she's having pain on both sides of her spine. And we're gonna have 2 channels running to each. All right, and now I'll take my leads. I'm gonna put them into each of these holes on top. And we're not doing interferential current, so we don't want to cross our paths. So we're gonna place 1 anode here and 1 anode here. So that way we have an electrical current through these 2. And then we'll take our other lead and place 1 here and here. Okay, and then now I'm going to show you some parameters that we're going to set. So this is our pulse width or our pulse duration, and this is our pulse frequency. Our parameters for our pulse frequency will be 100 to 150, but since she is just starting out, this one's closest set is 115, so we'll put it there. And then our pulse width is going to be 50 to 80, so I'm going to bring that down a little bit, about right there in between 60 and 110. Okay, and then our treatment time is going to be continuous. She's going to wear this for 24 hours a day, and our intensity is going to be we're going to ask our patient and converse with our patient, and we want an amplitude or an intensity, so our patient can feel a slight tingling sensation, but we don't want any muscle contraction. Okay, so I'm just going to turn this knob, and that turns that this lead to active. And then we're just going to turn it up, and we're going to ask our patient, okay, Haley, whenever you start to feel it, I want you to tell me, okay?
I feel it.
Okay. Is it tolerable?
Mm-hmm.
So I'm going to turn it up a little bit more. You let me know when it's not.
Okay.
Okay. I'm going to turn it back down. And is that tolerable?
Mm-hmm.
Okay. And what do you feel? Do you feel a tingling sensation?
Mm-hmm.
Okay, good. That's what we want. And there's no muscle contraction that's visible, so that's good. Let's just pull down and make sure. Yeah, and there's no muscle contraction, so that's what we want. Now we're going to turn this lead to active, and that'll turn this side on. And we'll turn the intensity up, and then we'll converse with our patient. Can you feel it? Let me know when you do.
Yep.
Okay. So now we're just gonna ask her, is that tolerable?
Mm-hmm.
I'm gonna turn up a little bit more.
Okay.
Is that enough?
Yeah.
Is it tolerable? Should I go back down?
A little bit.
Okay, I'm gonna go back down. Is that tolerable?
Mm-hmm.
Okay. So now we're looking for muscle contraction, and there is none. So now we can do exercises or whatever she needs to do throughout the day, and she can take it off while she's in the shower and going to sleep. Thank you very much.